Good afternoon and welcome to Webinar Wednesday. We're excited to have over 220 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Way t-shirt for answering this trivia question. October is Breast Cancer Awareness Month. Breast cancer is the second most common cancer for women. What is the #1 most common form of cancer for women? Answer now using the questions feature on your dashboard. While you're answering, I want to invite everyone to our full MD Expo, which will be taking place at the Hilton Baltimore Inner Harbour next week, the 17th to the 19th of October. We look forward to you joining us for 3 days of learning, networking, and the latest advances in medical technology, products and services. Registration is still open and more details can be found at mdexposhow.com. I would also like to mention that we'll be holding a big pink out party to support breast cancer awareness at the conclusion of the Baltimore Endo Expo. More details on the party can be found at mdexposhow.com/schedule. All right, and let's see who the winner of our Webinar Wednesday t-shirt is. And it is, David Wirrock. Congratulations, David. Webinar Wednesday would like to thank our sponsor, MEDIGATE. MEDIGATE's comprehensive and accurate device discovery capabilities combined with clinical contextual anomaly detection enables automated, rule-based, clinically driven security policies that keep clinical networks and patients safe. For more information, visit medigate.io. Our presenter today is Salil Panetta, Director of Sales Engineering at MEDIGATE. Salil, you may begin whenever you're ready.
Thank you very much, Linda. Good afternoon, everyone. My name is again Salil Panetta, Director of Sales Engineering here at MEDIGATE, and I'm looking forward to presenting automating medical device management for you today. So where I'd like to start is kind of framing the problem that we're setting out to solve and why automating medical devices is critical. So what clinical networks and healthcare organizations are struggling with is that the current process is very manual to do medical device inventory. There's a lot of resources used to spend on low-level tasks just searching for medical equipment across the healthcare network. Also, as you can see in these metrics, 40% of resources are spent on searching for equipment. 42% is about the average utilization of medical devices, and these are metrics that are kind of unknown right now to healthcare professionals. Similarly, 25% and more hospitals know that devices can be used more than one time. So these are very low numbers that can be greatly improved through automating medical device inventory and providing biomedical analytics. So let's discuss medical device lifecycle management as it exists today. So the current challenges, as you guys are very well aware, is that there's again a time and cost spent searching for medical devices, and there's actually solutions in the market that can automate this process so resources can be better allocated and not have spent cycles looking for these clinical devices. There's also an effort where manual data entry into the CMMS platform is again time consuming. This can also be automated through a medical device inventory and biomedical analytics platform. There's also a gap in terms of how often these devices are used and can potentially be repurposed. So a lot of device utilization data is lacking right now because again, there's no automated mechanism to actually track it. It's again a manual effort utilized using existing resources. And then finally, there's a lot of compliance requirements that are unmet because again, these devices are not found in clinical networks by existing resources. They don't know the current state of these devices in terms of risk profiling, how they can be potentially compromised, and again, tying back to not being compliant overall with HIPAA as well as other regulations. So what is the answer? Again, in terms of actually inventorying medical devices, this can be automated through a solution such as MEDIGATE. we can actually, again, track every connected medical device in a clinical network. We can then take all this data and actually integrate with your existing CMMS platforms and create a record of every clinical attribute we discover for that device. We can also look at network-based device utilization. So as these devices are talking to the PAC systems, EMRs, integration engines, we will actually track how often they're being used and then give you those biomedical analytics. And then finally, we can also give you visibility into what vulnerabilities exist on these devices as disclosed by NIST, FDA for device recalls, and then being able to correlate that against the discovered device inventory. So ultimately, what will happen is once a solution like this is in place, you're going to have real-time automatic inventory of all your clinical devices, offsetting the manual processes that exist today, as well as have location awareness data that can be tracked using, let's say, a Cisco Prime or a Rubrik Airwave. So you actually know where these devices live, down to the floor level, not only at a building level. And again, automated integration into a CMMS platform is key. So again, CMMS is the tracking platform used by clinical engineering to track their current devices. So not only you have an inventory of all your offline devices, but every connected medical device that can be discovered will also be populated as a dedicated record in a CMMS platform. Utilization metrics, again, will be readily available in a dashboard showing which, if we look at a fleet level of your infusion pumps, how many of them are infusing on a given day in terms of hours, how many are being less utilized, and how many can be repurposed. So this is going to help cost and procurement decisions in the future. If the teams decide at the executive level that we need more infusion pumps, but they see that the utilization is, let's say, only 50, 60%, and they now know which of those devices are not being heavily utilized, and that can obviously lead to some cost savings. Then finally, securing the devices is the ultimate outcome, because these devices are a target for adversaries, for patient data, which can be used for identity theft. Securing these devices and being compliant is the greatest goal that has to be met. And obviously inventorying them, finding out where they are, and then putting a remediation path in place to securing them is vital. Okay, so let's talk about each of these pillars specifically. So again, you know, we based on kind of the market research, and I think this number is actually a lot higher than what I'm showing on the screen here. About 36% plus of CIOs and CISOs are not very confident in medical device security because, again, they don't know where they live. And the biggest problem with this is that medical devices are not like traditional endpoints, as you can imagine, like a laptop or a server. You cannot put an agent on them. You cannot scan them. They're very sensitive. They're actually connected to patients. So if anything happens, there can be a significant impact just because it is a clinical device. So they're just given the uniqueness and complexity of a clinical device, there's definitely some challenges to actually inventorying them. That's why the manual process has existed so long, because there was no non-intrusive way to actually inventory clinical devices. So the approach MEDIGATE has taken is we are doing passive network traffic analysis, looking at port mirror traffic coming off of a distribution switch or router, and we actually will identify all clinical devices on their native medical device protocol. So we've actually reverse engineered over 80 medical device protocols, and we look at the payload in each of those medical device protocols and identify them as they communicate natively. And ultimately what will happen is as they're communicating, you'll get a dynamic updated inventory in your dashboard broken out by what you see on the screen here of all your patient monitors, MRIs, molecular testing solutions, etc. So again, just to differentiate between IoT and IOMT and medical devices, they're not created equal. This IoT is actually a much easier lift in terms of discovery because it can actually be identified using a standard set of network protocols that are very well known, like, you know, HTTP, SNMP, HTTPS, etc. So these are, again, well-documented protocols that have been around for a while. Um, Inversely, medical devices have their own very unique protocols and actually exist in the hundreds. So if you don't know how to parse and look at those medical specific protocols, there's going to be blind spots and ultimately false negatives when you do your device fingerprinting and inventory. So knowing protocol coverage across the spectrum for medical devices is key for medical device discovery. So I'm gonna just speak to, again, our process. We obviously have our own database of fingerprinting, and we actually create parsers for close to over 80 medical device protocols, as I alluded to earlier. So again, this is critical for getting very granular in device discovery and getting wide and deep to make sure every clinical device is discovered across a clinical network and nothing goes unaccounted for. So what are currently lacking to a manual process versus automated device discovery? So if you look at if you just look at the differences between these two slides here, you'll see that, for example, in a traditional CMMS platform, you might have IP address, MAC address, the manufacturer, and maybe that's about it, right? And in some cases, just because it is done by a human, it is prone to errors. So one of the benefits of automating this process is that the likelihood of it being incorrect is very minimal, and you're going to actually get a lot more granular data because, again, we are seeing that all that device header in the traffic when we do our protocol parsing. So just look at if you look at the device information gaps through a traditional manual process for device inventorying, you're basically getting about 3 attributes versus the 12 that you would get with us, right? So you're going to get, again, application version, hardware version, the protocol that we found it on, again, the device model, serial number, etc. So this, again, can fully populate a CMMS record that currently is lacking. Okay. So what do we do once we do our full device inventory? What are some options to integrate with your existing network access control solutions? So now we're going to be discussing on how to secure these devices. So if, for example, you guys, if you work with your security teams, you might have a network access control like Cisco ISE or Forescout, Counteract, or Rubric ClearPass. And one of the reasons these solutions exist is not only to find general IoT devices, but also to secure them to make sure they're only making authorized connections in the network and then restricting everything else. The shortcomings of these solutions is that they don't know what a clinical device looks like, right? A lot of these devices have embedded Windows and Unix distributions, so it actually comes out like a standard Windows Unix device without the NACS solution knowing that it is a clinical device. As well as, if you actually look at the figure here, this is what a typical device profile looks for a Cisco ISE solution. I know it's a little hard to read in the background, but it'll basically detect an IP, this type of IP it is, in this case static, and it knows it's a Philips device, but again, nothing more than that. So when you're implementing NAC policy, it's very important to have very granular information about a device before enforcing it. So again, through a MEDIGATE data exchange, we can actually populate so many other fields in a NAC profile of a clinical device, and then allow you to drive policy with much more accuracy and confidence. So again, just the additional fields we'll be able to report on is hardware version, OS version, the actual device model, the actual proprietary OS, the serial number, the application version, and of course the protocol. So again, I'm kind of I wanted to reiterate the importance of granular discovery. So, this is again a big lacking in current medical device inventory, where it's very hard to get, in this case, almost 32 attributes on a clinical device, knowing not only just what the IP and MAC in, but again, knowing the AE titles, the what VLAN it's on, knowing what the CMMS asset tag is. So this is something that can be actually pulled from an existing CMMS platform. We can then associate the tag into the device profile that we discovered during our network inventory. We'll also tell you again the location of those devices using access point solutions like Cisco Prime and Aruba Airwave, what SSID was found on, whether it was making internet communication. So again, was this communicating to the manufacturer for updates? Was it communicating for malicious communication? Was there antivirus installed? So we will actually tell you, based on it communicating to a known antivirus vendor for updates like McAfee, Trend Micro, Cisco, or Sophos, we'll see a call out for updates, and we know AV is installed on there. And this is available as a security insight in our device profile. And then finally, we'll correlate all this using a risk score. So again, taking into account what FDA class type it is, if it's known for transmitting and storing PHI, what are the known CVEs associated with this device, where in the network it's located in terms of VLAN. Is it on a VLAN that also has low-level IoT devices that if they get compromised, the adversary can get a foothold into that VLAN to compromise a critical medical device? Those are all factors taken into consideration when we calculate risk score. So again, very granular attributes can be obtained using an automated medical device approach, inspecting network traffic. Oops. Okay, sorry about that. I wanted to kind of provide an overview of what, once a solution is automated medical device discovery solution is in place, what are some of the metrics available for clinical engineering as well as security teams. So what will happen is you'll obviously get like a dashboard view of your entire medical device inventory, not only broken up by clinical devices as well as general IoT. Will tell you how many are currently online, how many were high risk, and I kind of already framed what we deemed as high risk, how many were found during a given week. Then we'll show different tiles breakdown by different manufacturers. So, whether it be ALARIS, GE, Roche, Philips, all the different device types we found, all the medical device protocols that were used to identify the device. So again, not only DICOM, HL7, which are the most well-documented protocols, but Unity, Hilltop, POCT1-A, Philips Data Export. Those are, again, proprietary protocols that if they're not reverse engineered and parsers built for identification, they will be missed using traditional machine learning and AI solutions. Then finally, all the high-risk devices of that discovered clinical device inventory that need to be looked at more than others based upon, again, known CVs that can be used to exploit those systems, as well as FDA class type and where they are in the network. Okay, so again, just further distribution, this is kind of we can also do something called a healthcare system view. This is a kind of your entire hospital system when you log in, and broken up by site. So this will be an aggregate count if you have, for example, multiple locations. In this case, this is a New York General Hospital with Delaware and Columbia location. And this view is basically showing the total aggregate count of all the devices across the entire healthcare system. And again, the similar breakdown by manufacturer, medical device models, and device type. And then if you go on the bottom, you'll actually see the specifics on a per site basis. How many medical devices are located in each location, how many are high risk, and how many of them are IoT. What are some other metrics we can get once we complete the device inventory? Well, we will start categorizing these devices based on the FDA class type. So we will break it up by patient devices, clinical lab, surgical, radiology, and then under each of those categories will tell you what the number of devices we found and how many of them are online, as well as how many of them are high risk. So again, organizing all your clinical devices, making it very easy to drill down and get to the information you need. So again, let's talk about, again, the device attributes. So on a per device level, we're going to tell you, again, not only MAC and IP, but again, serial number, application version, AE titles for DICOM devices, the location of those devices, when was the last seen, the individual utilization of those devices on a daily basis. So again, this is again insight and analytics that is kind of lacking and non-existent if you don't have an automated solution to do this. And just to continue, again, location awareness data is critical. If, for example, you have a Cisco Prime or Aruba Airwave, we will actually know the location awareness data reported by that device and tell you down to the floor where that device is located. So again, if pinpointing specifically the physical location of these devices is critical when you need to know, if a system is offline or if they're susceptible to an attack based upon known CVEs. We've also had a couple of instances where we had deployments where, because again, we're tracking IP information for these devices, the way we see hospitals work is somebody will take a device and just without any onboarding or notifying IT or security, just put it on another wireless network, and we'll actually track those devices as they're moving. So they actually know that it's moving from building to building, but they're able to pinpoint where it is at any given time and then make the appropriate decision. So device utilization, again, biometa analytics on a per device basis is critical. Again, as I mentioned earlier in the presentation, right now at a fleet level, no one has any idea how much of the entire fleet of infusion pumps, C-arms, glucose meters, MRI devices are being used overall, right? And this is, again, a big eye-opener when you're making future procurement decisions, as well as being able to repurpose existing devices. This is also a key metric in determining optimal times for patching. So if, for example, you have a utilization heat map and you know on a daily basis there's a window, let's say in the afternoon, that it's not being heavily utilized, that could be an optimal window for patching and working with the device manufacturer for updates. So that is also a metric that was used by a couple of our hospital customers to do that. So again, these are just some high-level metrics and charts that's available in our solution, but again, is very valuable for clinical engineering teams. So in this case, again, you're able to pinpoint how many on a per IP level, in this case, the CT utilization, how often it was used, right? Same thing with the infusion pumps. On a daily basis, what is the utilization across the fleet? Okay, so this is again our utilization graph in the MEDIGATE dashboard. Just overall across the fleet, if you look at an infusion pump fleet of 950, this is typically what you would get. How many were in use across the 950? In this case, 605. About 922 were used in the past month. So again, this is very good utilization, and there's very little waste. Only 67 were idle in the past week, and on average, about 521 has been in use. And again, if you actually look down on the bottom left there, under device utilization, you'll see on a daily basis the peaks and lows of individual device utilization across the entire infusion pump fleet. So this is an example again of how many PC units the ALARIS pumps were utilizing. So again, these are the specific PC units. This is the exact number of infusions that ALARIS infusion pump did on a daily basis. And this is, again, the granular metrics that is provided in our solution. So again, using our deep packet inspection technique, we pride ourselves in getting these metrics to you. We are completely healthcare focused. We have a lot of domain expertise. We know how these devices work, and it becomes very easy for us to give you these analytics because we see them in the traffic. Okay, great. So I want to talk about a CMMS integration example. So this is actually Nuvolo. We, again, integrate with all best of breed, best in the industry CMMS platforms, including Accruent and Accruent CMS, as well as Nuvolo, and I'm actually blanking out on the third one. My apologies. And actually ServiceNow as well. But this is typically what a record looks like in a CMMS integration. So we will actually import all these device attributes into the CMMS platform. So you'll actually see the data source is MEDIGATE on the right-hand column, and we'll actually, again, import asset type, connection type. First time it was seen, hardware version, IP address. I'm not going to go through the whole list, but again, everything that is probably lacking currently in a traditional manual entry with your Nuvolo CMMS platform. All right. So again, what is the overall use case for inventory and CMMS integration? MEDIGATE is going to discover all IoT and IoT devices dynamically through utilizing your network traffic without zero impact on the network. The CMMS, we can actually receive your CMMS from the hospital, and we will actually work together to resolve conflicts that you have potentially between the CMMS and our findings. And ultimately, we can become your source of truth for all clinical devices. Because again, network level validation of data is probably more reliable than manual entry of the same device. So again, there's going to be conflicts, and we will actually have, the CMMS will actually have attributes that maybe we'll never find in a clinical network, which again could be like asset tags. So all the asset tags that the clinical engineering team is confident is associated with the device, we will actually incorporate into our device profile in the dashboard. That's what the SSID is, and then we will again provide data back as well into that CMMS platform. So if you like to continue to work with the CMMS platform, we can then, once we resolve conflicts, we populated all the relevant metrics for those devices, we can actually push that and have that be the primary record if our dashboard is not what you would like to log in. So this is an example of what we found. This was a typical CMMS record that was there, and about 5 CMMS records that we found, and what we were additionally able to find through our deep packet inspection of the same devices. So we actually found IPs that were incorrect. So if you look at the first record, 32154, the IP we found was 201 and not 207. We actually found that it was on VLAN 116 that was not available in without doing the network level analysis. Manufacturer was obviously correct, model was correct, serial number was correct. We're actually able to then additionally find the operating system for that, which was Nucleus for this C-arm. On the second one, we found, again, the VLAN that was not there, and then we were also able to find the serial number, which was not available, even though it was available for the previous entry, and then we were also able to find the operating system. So again, finding additional attributes that were non-existent and also correcting previous entries that were incorrect. So IP addresses that were incorrect, as well as serial numbers and MAC addresses. So this is another great example of having CMMS and MEDIGATE work together to do full data enrichment. So one of the things we'll never be able to find is a tag number, because that's not available in the network. Is not available in the network traffic or the packet headers. So that's only available on this in the CMMS platform. So once we correlated the discovered connected device in the CMMS platform, we can actually import the tag number associated with it as an additional column and have it available in the dashboard. Okay, so again, just to recap, what is the problem with manual CMMS entry and discovery? Again, it provides very little visibility, just given the nature that it's manual, and it's very time consuming, and it's a very low level task for clinical engineering. Tracking and locating the devices is nearly impossible, just because they move around and there's no formal onboarding process or getting them on the network. It's kind of a wild, wild west, to put it, not to oversimplify it, when we come into clinical networks. And again, patching and updating is almost non-existent, because first of all, they don't know, clinical networks and hospitals don't know where the devices are to begin with. And then, so that obviously leads to not knowing what operating systems they have and what vulnerabilities they can be susceptible to, and then ultimately not patching them at all. Again, active scanning should never be an option for discovery. There's a very high likelihood that it can be taken down given the sensitive nature of these devices. So only through passive discovery should a clinical device be found. And I mentioned again our approach to that problem using protocol parsing, medical device protocol parsing, looking at port mirror traffic, and ultimately it requires a close collaboration between a vendor and the clinical engineering team to make sure all the discovered devices are accurate and in line with expectations. So, and I'm not gonna, I'll just kind of quickly, I know this is a lot of this is redundant, but basically, using passive network traffic analysis is really the only way to do complete and granular device inventory. And then being able to know where they exist in the network down to the building level, if that's available through your Cisco Prime wireless connectivity to give us location awareness data, as well as being notified of vulnerabilities, recalls, outdated firmware on these devices, so biomed teams can take action and start resolving and securing these devices. And ultimately, we want to help you operationalize this data in inventory. So as we start profiling, alerting, we want to make sure they work with your existing workflow systems, whether it be, again, CMMS, a ServiceNow ticketing system, a SIM like Splunk, or integrating into your NACS solutions for enforcement. Okay, so I wanted to quickly touch on vulnerability and patching alerts. So this is typically what you can find in a device once it's fully inventoried by MEDIGATE. We'll again not only tell you all the clinical attributes, but we have something called insights, where we'll actually show you the device actually made an internet connection. It hasn't been seen for over a week. We actually found outdated firmware. So this is again based upon we have direct feeds from manufacturers, where once they've released the latest firmware, we will correlate it against what we discovered in the network, and we find that it's actually less than what's the latest firmware available. So basically a delta between what was discovered and what's currently available. Then also in this case, there's a relevant advisory. This is in this case, a blue key vulnerability that was found on this device. So we're going to take all this into account to create a risk score. And the risk score is based on three metrics: device vulnerability, network, and severity. So essentially device state and network exposure. So device vulnerability, we found this to be a legacy XP embedded system. It actually has a blue key vulnerability on it based upon OS correlation. We found outdated firmware, and there was no AV installed on this, so there's no compensating control to restrict any potential compromise. On the network side, it was a wired Ethernet connection, but it was found on a network topology that is a mixed type clinical VLAN. So this device actually it sits on the same VLAN as low-level IoT devices. So it could be a security camera, a VoIP phone, a clock, and again, and all those are again exposed to the internet. And if any one of those devices gets compromised, it can actually gain a foothold into this VLAN and then have access to this Philips ultrasound. Finally, the FDA class type. So this is a class 2 device, so it is on the higher side. So there is going to be patient impact if it gets compromised. And then it is also known for storing PHI, transmitting and storing PHI. So 50% of that device vulnerability led to a high, 20% of the severity led to a high, and the 30% was a medium. So 70 out of 100 was a high, so the overall risk score is a high. Yep. So just some of the alerting we can also provide. Again, as soon as a firmware is released, we'll correlate it against all applicable devices. We'll tell you which of them they are, how many are outdated, and then this can actually be sent as a ticket through a ServiceNow or send as an alert to any kind of workflow system to the appropriate owner of those systems to take action. We also have threat intelligence built in. So there's a threat banner that's available on our dashboard where, again, this is a Philips Hard Start recall for your defibrillator. So again, as soon as that's released by the manufacturer, we will provide it as a feature to our customers, and you can quickly click on the number of impacted devices and get that list exported or create a ticket using your CMMS platform or ticketing system, and then assign it to the appropriate clinical engineer. MEDIGATE also can do integrations with your vulnerability management platform. So this is very interesting, and I kind of talked about this earlier. Vulnerability management solutions, they don't know what a clinical device looks like because, again, a lot of clinical devices have proprietary operating systems, and vulnerability management solutions have fingerprinting techniques based on ICMP and TCP, and it's based on a fingerprint library. And as you can imagine, they don't have a very large medical device fingerprinting library. So they basically base it closely on what type of known Windows or Unix distribution it is on. And to them, it looks like a standard Windows or Unix system. So we can provide visibility into that for a vulnerability management solution, saying this is, again, a Philips device, a GE device, a ECG device. And then what we can do is allow them to restrict or blacklist these devices in future scans, so you're not inadvertently scanning them if enterprise-wide scanning is allowed. Or what we've seen customers do is actually create a lower profile scan, throttle it back, so again, the clinical devices only are definitely getting non-intrusive scans or very limited port scans as part of their process. We can also bring in all the CVEs identified for these clinical devices and actually use that to calculate our risk scoring. So if internal scanning is allowed, we will, again, take all the CVEs discovered and validated by your Rapid7 or Tenable and bring that into the risk scoring for each of the clinical devices and let you know what they are. Okay. So again, here's kind of all the things we can integrate with on the security side. So for firewalls, MEDIGATE can actually do tagging-based enforcement. We will, for Palo Alto Panorama, you can actually create a tagging-based policy saying, for example, an MRI system can talk to all MRI systems with the MRI tag can talk to the PAC system, communicate on DICOM, communicate, let's say, to the Siemens manufacturer and AV vendor, but then restrict all other communications. Then once we find a new MRI system, we'll just put an MRI tag and update that blanket policy that was already put in Panorama, and then we'll just keep updating that same policy. So it's actually a very clean, elegant way to do enforcement if you have east-west firewalls and you want to restrict communications only to authorized and trusted sources. Similarly with Checkpoint's Smart Console, we can do the same thing. With Smart Console, we actually have a tighter integration. You can actually see all the biomed views you saw earlier in the presentation with the actual images of the devices, and drill down into each of them as well in the Smart Console. Cisco Firepower, again, tagging-based enforcement, as well as with Fortinet and VMware NSX. NACS, I already spoke about. Basically, the ACLs will create specific to the devices, only allowing authorized communications on a port protocol basis to specific destinations, and then restricting everything else. So again, using your NAC solution, turning it into essentially a clinical NAC, as we like to call it for hospitals, where now they have visibility into all their clinical devices and know what clinical workflows are allowed, and then restricting everything else. Your SIM platform, this is again going to be your aggregator of all data. So again, we have integrations with all the SIM providers you see here. We can basically export all those alerts and events into your SIM, where you can create dashboards, assign tickets, and create any workflow you like using your SIM platform. And vulnerability management, I already discussed earlier. We also support Qualys in addition to Tenable and Rapid7. Okay, and just rounding out the integrations, DHCP, DNS, we can actually take in MAC address information to help with data enrichment for a lot of our device discovery. Wireless location for Prime and Aruba will tell you geolocation metrics for every discovered device. We can also integrate with NetScout to do monitoring of the devices if something goes down, and again, ticketing with ServiceNow. And finally, we have support for Philips and Capsule, so we can actually identify Capsule medical device integrators. So this is again a big differentiator for our product. If we actually will not only identify a Capsule medical device integrator, we'll actually tell you the individual neurons that are connected to it and the network flows that are communicating within each neuron. So again, this is part of that integration with Capsule, where we actually know how to parse that protocol and then actually find the devices behind the gateways. So finding devices behind gateways is also a big benefit of deep packet inspection that MEDIGATE provides. Here's all the CMMS platforms, and I apologize for not mentioning them earlier. So Nuvolo, AIMS, Metamizer, Accruent are the four main ones we currently have integrations with today, and you definitely saw the benefits of the bilateral integration that we can receive, as well as the CMS platform can receive. And finally, I'd like to kind of wrap up with some of the Cisco ICE use cases. This is again based on a very large hospital. As you can see, 50 plus hospitals. It's a single hospital, single large healthcare system with 50 plus hospitals, 15,000 beds, over 500,000 connected devices, 80,000 connected medical devices, where we actually implemented a Cisco ICE integration, where they are actually doing policy enforcement. So again, the first part was a visibility, finding every connected medical device, showing all the clinical attributes, showing all the workflows, creating those downloadable ACLs specific to every device, and then integrating that with their Cisco TrustSec platform to create authorization profiles for enforcement. So again, I think overall, I don't have to stress how much value this automating medical device inventory can be for any hospital network. Again, right now there's so many gaps, just given it's a manual process. There's a lot of blind spots in terms of what devices exist, how they're being utilized, what's the current state of security on them, how to secure them. So again, there's so many metrics and benefits to be had just putting in a solution like this, in terms of not only finding the device, tracking them, being notified in real time if something is compromised, allocating them to the appropriate user for remediation, and then ultimately reducing your overall security exposure. Okay. And this is I like this slide. This is again a breakdown by different teams in a healthcare entity, who would benefit at what layers. So again, IT and security will now know where all the devices live. So clinical devices have been historically been an accepted risk in healthcare organizations, just because again nobody knew where they were, and if you don't know where they are, you just kind of say, if something happens, we're willing to take that chance. But now that we can actually start doing full inventorying of all these devices and give you visibility of which VLAN they're located in, how they're communicating, if they're communicating to other internal devices that are outside of clinical workflow, if it's talking to a malicious CNC site where it's potentially compromised. Again, these kind of alerting can all be sent to security and IT teams for quick response and remediation. And obviously, the biomed clinical engineering team, the value is immense with integration with CMMS and just knowing all their clinical devices, where they're located. And same thing with clinics and patient services, knowing the biomedical utilization for scheduling future sessions and just being more efficient in device management and patient care. Okay, and finally, I'm not going to spend too much on cost savings, but there's going to be definitely an ROI with the solution like this. Less purchase, fewer purchases once you find out there's less utilization of your existing device inventory. Being able to find equipment quicker and faster, and having accuracy in that is always going to lead to better maintenance over time. Your incident response time is going to be greatly reduced, just because now have a solution that can inventory and alert you as soon as something is anomalous, and you will actually overall have reduced costs because you have a more efficient process to fixing and reconciling these assets. Okay, and again, finally, I'm not going to stress too much on why you should choose this technology like ours, but I hope the insights were informative on why an automated medical device management solution is necessary and can be invaluable for a healthcare organization. Okay, so with that, I'd like to stop and we'll take any questions.
Great, thank you so much, Salil. Yes, we have quite a few questions here. The first one is, what are some of the shortcomings of machine learning and artificial intelligence techniques for medical device discovery?
Great question, Linda. So some of the shortcomings with machine learning and AI is they are actually very good for IoT, but actually do not do as well when fingerprinting clinical devices. So machine learning and AI is essentially what it is at a high level is you're taking a model and training it with a lot of samples. So if it could be in the millions of samples, and overall it might work well in a general network, but in a hospital network where it's very unique and complex, and you're dealing with medical device protocols, and if you've never seen a medical device using a proprietary protocol, it does not know how to identify it, because again, it hasn't been trained to identify it. So again, in terms of the feed into an AI or machine learning solution, that sample was never available, and only parsing at a protocol layer will allow a solution to identify those devices. But machine learning and AI will lead to a lot of false negatives. They won't find the devices, as well as a lot of false positive or misidentifications.
Okay, that's great. Another question is, what are some remediation paths to securing medical devices if patching is not an option?
Yes, great question. So, and this is going to be the case in a lot of healthcare organizations. Patching and working with device manufacturers is not easy, and as well as you cannot take the devices offline, or there's very few windows to take those devices offline for patching. So, putting these devices on their own dedicated VLAN, as opposed to a mixed clinical, to just allow it to talk to like devices and only make authorized communications, as well as working with your existing enforcement points I alluded to earlier, like your firewalls and NACS, to only allow authorized communications internally as well as externally, and then restricting everything else. So network level exposure, if that can be drastically reduced, that will put the device in a much better place to be less compromised.
Great. Another question is, why is it important for medical devices to be on the dedicated uniform VLAN?
Yes. So again, if a low-tech IoT device is found on the same VLAN as a clinical device, those can be easily compromised using very basic techniques. Like, for example, you can have a VoIP phone that can be brute force using the SIP protocol, and again, that can very easily allow an adversary from the outside to get into that same VLAN and then have access to critical patient-connected clinical devices. So again, uh, having those devices on their own dedicated VLAN and not have it talk to a general IoT device is absolutely critical just to avoid that scenario.
Okay, that's great. I've got quite a few questions about utilization. One, I'll give you a selection so you can expand. How do you get utilization information? How is it tracked? And how is it based upon network activity?
Yes, great question. It is based on network activity. As we're seeing the communications these devices are making to PAC systems, EMRs, we are tracking all that information and then basically providing those charts and metrics I alluded to earlier. So we've actually have expanded this into something called deep DICOM utilization. We can actually tell you, for example, now the number of examinations that an MRI machine is doing and the number of images on a per examination level as well. So all that is through the network traffic analysis.
Okay, so how are you able to determine device models based on network traffic?
Great question. So it starts with our protocol parsing of the medical devices. So we study these devices extensively at MEDIGATE Labs. We personally procured them. We know what they look like. We know how they function. We work directly with device manufacturers. So a lot of the metadata is found in the traffic. It is actually quite verbose at times, but so we will actually get about 10 to 12 attributes just in the initial protocol parsing and fingerprinting stage. And then as we see additional traffic and communications over time, we will do further data enrichment. So that's how we ultimately get to those 30 plus attributes for every medical device.
Okie dokie. In a hospital, what's the average percentage of medical devices that have Wi-Fi ability?
Quite a few. Almost everyone has a wireless LAN controller. So that is getting wireless traffic is an essential part of the discovery process. So we're seeing a lot of the infusion pumps and anesthesia carts, etc., on wireless access points. So they're actually mobile. So I would say almost every hospital network I've personally seen and as a Medicaid customer has wireless networks and with medical devices connected to it.
Okay, another question is, does your process apply to non-network devices that have mobile media capability, e.g. flash drive, CD? In particular, do you provide insights to operating systems, threats, patches, etc.?
Yes, so if there's no network connectivity, that is something we cannot identify. So like a USB flash drive connected to a laptop, we cannot identify that. That probably requires an agent. If let's say a file in that flash drive is communicating outbound from that laptop, we'll see that communication, and then we'll know it's coming from that endpoint. So we'll basically track it down to the endpoint if we're seeing a network communication flow of that device.
Okay, that's great. And we've got time for about one more. Let's see. With respect to DPI, what is Medigate's plan when OEMs move towards more modern computing practices that include PKI certificates, encrypted streams, and DPI becomes less useful to pull analytics?
Yes, great question. So right now we've been talking primarily about unencrypted traffic. We will identify, we could still get a lot of metadata from encrypted traffic using certificates and ciphers. If, for example, the decryption key is also provided by the client, and in a lot of cases, in some cases they are, because obviously it's a collaboration, then we will use the decryption key to look at that unencrypted, to decrypt the traffic and look at the information inside of it. But it is something that is definitely evolving. But for the most part, what we're seeing in a lot of the hospital networks is that all the techniques and tradecrafts we have designed with DPI has been very responsive, and we are getting very granular and rich data to date. But it is obviously a work in progress, and our team is actively looking at improving our identification techniques over time.
Okay, that's great. Just going to squeeze one more in. This is more of a general one. How do you get a cost-conscious hospital to buy this?
We are our focus as a startup company is customer acquisition and showing value, and cost is secondary. And I know I'm speaking that as a sales engineer and not a VP of sales, but I please hold me to that. We will welcome anyone who would be interested in our solution, and we can show value, because our first and foremost is helping customers and showing value, because we know this is a big problem, and ultimately we want to be the best in the industry at this. And we can look at creative ways to offset the cost, either by the hospital being a reference, or being an advocate of ours. So there's a lot of things besides cost that we're interested in with the customer.
That's great. Thank you so much, Cecilio. We're coming up to our hour now, so thank you once again for a great and very informative webinar, and obviously thank you again to today's sponsor, MEDIGATE. Just a reminder that the post-webinar survey and certificate process is now automated, so the survey link will be included in the follow-up email, which you'll receive in about an hour's time. Once you've completed the survey, you'll be able to download your certificate immediately. One lucky attendee will win an Amazon gift card just for completing the survey. Now, if you have any questions, please contact us at webinar@mdpublishing.com. For more information about our upcoming webinars, please visit our website, webinarwednesday.live. So thank you once again for everybody joining us. Enjoy the rest of your day, and we hope to see you again next time.